diabetes who had these things going right. Blood sugar under control, that's the gold star measure for people who have diabetes. Of course, there's probably a number of people in the room who do. Blood pressure under control, because next to blood sugar, blood pressure, best predictor of whether or not you're going to have a heart attack. LDL cholesterol under control, not smoking and daily aspirin use. If we were nailing all 5 of those things, working with you as our patient, we count you. And we were getting that right 9% of the time when we started measuring. First place in the country to start this kind of measurement. It's now used statewide in Minnesota, still isn't used nationally as fully as it might be. I think it will be over time. It's kind of it's an all or nothing measure. This is called the Grand Slam for diabetes care. We're now up at 38%. We just hit 40 in the last month. We have individual doctors who are up towards 60%, and we have individual clinics that are up about 50%. Now, without measurement, we would never have known what to shoot for. If you were one of our doctors, you never would have been able to say, how are my patients doing? How am I doing with my patients? Oh, and by the way, how are my African American patients and my Native American patients doing compared to my white patients? Another question we're able to ask and start to address some healthcare disparities at the same time. So this work, I don't consider it to be done. And when I mentioned those 8% of the people that are hitting that optimal health measure of exercise, eating right, well, gosh, we started this, actually started at 4. I remember looking at our medical director and thinking we're going to be 80 years old by the time we get to 10. Do some things differently. But that number's at 8. Looks awful similar to that 9. And look what we've been able to accomplish with redesign, technology, setting some goals, feedback, and engaging patients in a new way, engaging our members in a new way. Result, 364 heart attacks, 68 amputations, and reduction in compromised eyesight to the tune of 600 each year. Our ophthalmologists tell us they almost never see a case of advanced diabetic retinopathy in their patients anymore, simply because care for diabetes has gotten so much better. And I don't want to just say HealthPartners is doing this. This work is now going on across the entire community here. We are probably delivering world-class diabetes care in Minnesota right now compared to any place else in the world by using these kinds of tools. And then are patients happy with it? Well, 98% would recommend us, so would we like that to be 99? Of course we would. Keep working towards that. But I think it says we're certainly able to meet people's needs and have them want to continue to receive this new kind of health care. So that's the report card that HealthPartners Board of Directors looks at. And I'm kind of sorry now that it's so simple because I can't obscure the results with complicating factors. But I do hope that we're able to move to another more sophisticated measure of health that really starts to speak to are we delivering on that mission of improving health. We need to reform payment approaches, take that emphasis off fee-for-service because fee-for-service doesn't pay for some important things. Doesn't pay for time with families. Doesn't pay for care coordination. Doesn't pay for all the phone calls that people really need to do when they're trying to make sure the nursing home is ready for an admission of an elderly patient with congestive heart failure who just had a hip replaced. It really doesn't accommodate team care. It really doesn't accommodate family time. What it accommodates is one patient after another in an exam room, and boy, it accommodates even better if you order a lot of tests. So it's a very good reinforcer of preventive medicine. It doesn't pay attention to who's doing better in their results for diabetes care. It doesn't pay attention to which hospitals do a better job of avoiding infections that the hospitals cause, by the way, for their patients. It doesn't pay attention to, just starting to pay attention to, are we actually operating on the right body part? For the first time, Medicare is starting to say, if you do it wrong, we actually aren't going to pay for it. That practice began with HealthPartners 4 years ago and hadn't even been put in place before that. You wouldn't pay for your car if they did the wrong thing. And yet our healthcare system wasn't even looking at that issue. We need to move to those total cost of care approaches because I can heavily discount my fees for an MRI, but if we're doing more MRIs, healthcare costs go up. And then we need to make sure that we're not paying more for very specific sets of services. It's been a problem with Medicare. We have a lot of cardiac centers, we have a lot of orthopedic centers, we have a lot of imaging centers. Why? Because that's where the money's been in healthcare. That's where the profit has been. We have hardly any mental health. We have few doctors going into primary care. Why? Because Medicare, the biggest source of payment, pays very poorly for those sets of services. So reweighting will help us deal with some of the places we have more capacity than we need, and some where we don't have enough. When you have chronic illness, you need general internists. There is a crying need for general internists. We have a new profession. HealthPartners is actually, there's a blessing and a curse here. We have a ton of internal medicine grads who, instead of choosing to see elderly chronic illness patients in their offices, are choosing to do high-tech, challenging, really interesting hospital-based work. They're called hospitalists. And to me, they mainly look like they're 17 years old, but they're the most enthusiastic group of young physicians I've encountered in years. But those are, unfortunately, the same pool of people who would probably be our general internists generation ago. So a lot of work to do there. Leveraging technology, I already mentioned, because we have started to collect race and language information, we can look at healthcare outcomes and in ways that allow us to address disparities. We have disparities based on race in our state. Our doctors would see the state numbers and say, well, that's not true for us. It must be somebody else, because we treat all our patients the same. What we're learning is we actually don't want to treat all our patients the same. We want to treat our patients as individuals, and we want to recognize cultural and language differences and communication differences. And so, big opportunity to use health information technology to change that picture, and frankly, do a better job of getting interpreters in the room. And we can be far more proactive. We were able to be proactive for the first time, so a generational switch, when the H1N1 outbreak took place. We were able to reach out to our patients who were in specific risk groups and say, your number's up, come on in. We can give you that vaccine. We have about 200,000 patients who are using online services, another big cultural breakthrough in healthcare. We've delivered more than 10.5 million test results online. You think, oh, that's nice. You know, that's big volume. They're doing some cool stuff technologically. The breakthrough wasn't technology. The breakthrough was with doctors. Because the mental model in healthcare has been, it's our healthcare information about you, and you get it when we decide to give it to you, and you get it after we've worked it over. And best yet, why don't we just keep it secret from you? And then you can learn about it when we think you need to know. The breakthrough was working enough with the doctors and nurses to have them say, you know what, it's okay with me. If the patient wants that information, the patient gets it the same time I do, that's cool. It's changed our oncology practice. So our cancer doctors who are concerned about this, do patients really want to get their bad results online without being in the room with me, the doctor, delivering the news in person? You know what, 80% of them do. And they'd rather have the information online, they would rather get the information themselves, they'd rather work through the issues and save a sleepless night, and they'd rather be able to come to a visit with the doctor prepared to talk about what we're going to do instead of dealing with the emotional impact, good or bad, of a test result. Now 20% don't. 20% want to sit down with you, the doctor, in the exam room and have you tell me face to face what those results are. But what a change to be able to deliver a choice that didn't exist before. And for us in healthcare, mobile apps even starting to take off. We're seeing 10,000 people a month just to access where's urgent care, how long is the wait time, and how do I get there. That was the first thing in